Okay, so our next segment we're going to talk about the crusty issue of shin pain. Now, shin pain is something that's very relevant to everybody who's on Bartol biomechanics, whether it be retail or medical. You will all see this for sure, and it's quite often a difficult condition to treat. And one of the reasons is that we actually don't know a great deal about exactly what we're dealing with here. So I'm just going to run through a couple of different variants here and some of the things that you do need to look out for. I think by far the most common form of shin pain we see is especially in runners, and it's the medial variant. So we sometimes call this medial tibial stress syndrome, or MTSS. You'll see that mentioned often. And basically what happens here is that the runner will present with pain along the inside of the tibia here, so the medial side of the tibia. Can often stop them running. It can become so painful that they're just unable to run. Now, typically what you'll see here is you'll see pain over quite a large area of the shin. It's normally in the lower 1/3 of the shin, so we don't tend to see it in the middle third or the upper third. Far more common in the lower 1/3. And you can just palpate along the crest, the inside of the tibia here, where the deep flexor muscles are attached. You can palpate along there and it will actually be quite painful. Sometimes you can have a little bit of swelling in this area, but I think swelling's a little bit unusual. However, when you do this, the patient will tend to not enjoy it very much at all. It really does hurt. Now, the reason that I'm talking about the distribution of pain here is that one of the other potential differential diagnoses with this is a tibial stress fracture. A tibial stress fracture can present in exactly the same fashion as a medial tibial stress syndrome. The main defining difference here is that it tends to be a lot more localized. So you tend to have a much greater focus of pain in one small area. We don't see it over the broad distribution. So if you've got somebody who's got point tenderness, and I always get people to say, I always ask people to point with one finger. Point with one finger to where the pain's worst, and if they can home in on that and you can get on that area and it's very, very defined, you'd have to have a very high index of suspicion that you are dealing with a stress fracture rather than medial tibial stress syndrome. So that's an important differential. Some of the other things that might give this away, sometimes stress fractures are also quite painful at night. So there's a differential in pain. Also the pain can tend to go on a little bit longer. With the traditional shin splints, which is a term I hate but which is used a lot, the pain tends to go away almost immediately after you stop running. So you don't get that ongoing pain. With a tibial stress fracture, of course the bone's been compromised, the pain can go on a little bit longer. Now the other type of shin pain that you can get is not distributed medially, but it's in what we call the anterior compartment, sometimes called lateral shin pain. This muscle here is called tibialis anterior. It's a very, very important muscle. It's responsible for dorsiflexing and inverting the foot. So you can also get an overload of this muscle. It can become painful, and you can get a broad distribution of pain over this area. What exactly is shin pain? What are we dealing with here? Well, it's very controversial. We're not sure whether it's inflammation of the muscle. We're not sure whether it's involving the periosteum, which is the membrane that surrounds the bone that the muscle is sometimes attached to, or it may well be that it involves the fascia. This is one of the new considerations in terms of this injury. So it may well be that we're actually dealing with a fasciitis, which is quite interesting. The bottom line is we don't exactly know what the actual pathology is at the moment. Now there's one other very important injury we need to talk about here that we can't overlook. It's called exertional compartment syndrome. This is where the muscle gets used to a degree where it actually blows up. It becomes effused with blood, and because the muscle's enclosed in a fascial sheath, so you imagine the muscle is a little bit like a piston sitting inside a cylinder. When it's effused with blood, it's got nowhere to go, so it is swelling within a compartment that won't allow it to expand, and it actually shuts down the blood supply to the muscle. Now this is a big deal because when you shut down blood supply to muscle, the muscle dies, and when that happens you have permanent issues in relation to the foot. We regard this as a medical emergency. So that has to be operated on straight away. The muscle has to be allowed to bulge out of the fascia so the blood supply can be re-established. If you've got somebody who it seems to be in an extraordinary amount of pain, if you've got somebody whose pain just won't go away with rest, that is something you need to consider. That is something you need to get expert opinion on straight away. It needs to be dealt with immediately. The other time this can happen is if you have a blow to a compartment. It's most common in the anterior compartment here. Imagine a sport like soccer. You get kicked in the shin, you get a big swelling within the muscle or a big bleed within the muscle. It's got nowhere to go. It shuts down the blood supply. You've got a big drama. You've got a compartment syndrome. So that's just something that you need to be aware of. The pain is normally intense with compartment syndrome, so that's how you pick it. Alrighty, so we've got several different forms of shin pain here. I think we're going to focus mostly on medial tibial stress syndrome because that's by far the most common, especially in runners. What's your immediate action here? Certainly your immediate course of action would be to instigate anti-inflammatory protocols, so you'll be using ice. You could certainly look at some anti-inflammatory medication just to try to control the immediate inflammation. And then once you've controlled that immediate pain, then you need to be looking at all the other things that you would do for an overuse injury. Perhaps the most important of all is rest. So you've definitely got to counsel your client to rest. That's sometimes very difficult, especially if you've got an elite athlete. But that is a very, very important part of the whole treatment program. So you've got to explain that a couple of weeks off is better than having the problem go on for 6 months, and that's often the equation. So rest, activity modification, by all means you can be doing other things like running in the deep end of a swimming pool. Probably if you've got shin pain and you're a runner, things like cycling will probably be fine. Basically other non-weight bearing activities that will maintain some degree of aerobic capacity but without stressing the muscle, very, very important. Biomechanics again play a big role in this injury, so you've got to have a look and see what's going on at every level. And when I'm talking about biomechanics, I'm not just talking about what goes on at the foot. We tend to get focused at the foot. Biomechanics includes all sorts of different things, including muscle tightness, muscle weakness, structural issues. All of these things have to be looked at and have to be addressed. Footwear is also quite important. There's some good evidence to say that if you wear the wrong type of shoe for your particular biomechanical profile, that you may well stress the muscle, and that may be a big part in leading to injury. Training, I've got to mention, also very, very important. If you increase your training very suddenly, you're begging for an injury. If you decide you're going to go from a traditional shoe to a zero drop shoe very quickly, you're begging for an injury. If you decide you're going to do a lot of hill work very quickly, that's also a problem. So it's all about sensible training. The moral of the story with anybody who's involved in a running sport is don't change anything too quickly, okay? Mix up the signals, by all means get on different surfaces, but don't make wholesale changes too quickly. Don't change your form very quickly, don't change your shoe very quickly. Orthotic devices certainly play a role in this. There are some good taping protocols for this particular condition. There's some evidence that kinesiotaping may have a role in shin pain. I think that's probably got to do more with controlling muscle vibration than anything else. But there's some quite good research out there at the moment looking at this. Okay, so that's shin pain, a bit of a snapshot of that, some of the things to watch out for, some of the differential diagnoses. The next thing we're going to have a look at is Achilles tendon pain.